which side effects, so now we're going to a different question. The question before was about the effectiveness of a treatment, the effectiveness of a medication. Now it says side effect. Okay, which side effect should the nurse explain to the male client? We're talking about teaching here. Who is prescribed cimetidine. Okay? So this question deals with teaching, and it has to do with side effects. So what teaching I can give to my patient about the side effects of cimetidine? Answer number one, the medication can cause indigestion and heartburn. The medication can cause impotence and gynecomastia. The medication can cause insomnia and hypervigilance. And the medication can cause Zollinger-Ellison's syndrome. You need to know the medication that they're telling you here, the effect, the intended effect of the medication, the side effect, and the adverse effect that could be experienced in this scenario, okay? So answer number one says, and I saw some of you selecting answer number one, so I tell you why answer number one is not the answer, okay? Some of you selected the medication can cause indigestion and heartburn. Well, the first thing that we gotta know, what is cimetidine? Cimetidine is an H2 receptor blocker. It is used to treat indigestion and heartburn. So answer number one does not make sense because I give this medication to treat exactly that problem, indigestion and heartburn. Okay? But also, think about of the side effect, intended effect, adverse effect description that I gave you earlier during the class. Answer number two, the medication causes impotence and gynecomastia. So answer number two, the first thing that you have to know that cimetidine can cause impotence and gynecomastia over time. It is over time. The more the patient takes this medication, the longer it takes this medication, the higher the risk of developing the impotence and gynecomastia. So if it's something that happens over time, we're not talking about an adverse effect. Okay? Remember, adverse effect, acute, something rather quickly, life-threatening condition. Is impotence and gynecomastia, is that a life-threatening condition? No. So side effect and answer number two makes sense because impotence and gynecomastia it is a side effect, an undesired effect, but doesn't bring a life-threatening situation. So answer number one was eliminated because that is the reason of why I give cimetidine. Answer number two is a possible answer because impotence and gynecomastia are side effects that could be seen when the patient takes the medication over time. Answer number three, the medication can cause insomnia and hypervigilance. It's completely the opposite. The patient can experience lethargy and somnolence. Okay, so answer number three does not make sense. Answer number four, the medication can cause Zollinger-Ellison's syndrome. Maybe some of you don't recognize what this is. Zollinger-Ellison syndrome is a rare condition that causes different problems, tumors to form in the pancreas, upper parts of the small intestine, and the patient can develop a situation where large amount of a hormone called gastrin which causes a higher production of acid, hydrochloric acid. So the Zollinger-Ellison syndrome can manifest a scenario where too much acid is being produced and the patient may need cimetidine to treat the symptoms seen in Zollinger-Ellison syndrome. So answer number 4 is eliminated because it is not a side effect of cimetidine. The correct answer is answer number 2.